Swadika and good afternoon, and this is the English language summary of the daily press briefing, live from the Center for COVID Situation Administration, or the CCSA. And today is a briefing for Friday, the 16th of July, 2021. I'm now following the briefing from Dr. Apisamai Sirangsan, the Deputy Spokesperson for CCSA, and today she summarized a very important meeting. We had a special CCSA general meeting chaired by the Prime Minister this morning. And this is because there was a need to assess the COVID-19 situation in Thailand after we had implemented our recent public health measures, which were announced last week and were effective as of Monday, just this Monday, specifically for the 10 provinces at highest risk, which was Bangkok and its surrounding provinces, plus the 4 southernmost provinces of Thailand. Unfortunately, since the measures were in place, the situation has not improved, and we've seen more new highs in both new confirmed cases as well as, regretfully, new fatalities. And therefore, there was a necessity to assess the cause and determine how we need to move further. And it was found that there were about 739 cases of violations of these public health measures, including violations of curfew, unnecessary social gatherings, as well as movements across provinces, particularly from those dark red zones, which has become the cause of more potential infections and local transmissions. And this is a cause for serious concern to the CCSA and has necessitated the considerations to implement even more stringent measures, such as restricting mobility of persons, as inconvenient as they may be, as well as closure of even more establishments. And these measures are important and necessary because we need to save more lives and any risks of any more transmissions in Thailand. And at this very moment, a meeting is going on this afternoon to consider the details of these new measures, and we will share them with you as soon as possible. Allow me now to run through the statistics for today. I'll start now with the numbers of vaccines that have been administered since the start of a vaccine drive. As of today, we have inoculated almost 300,000 doses of vaccines already, and this brings us to a total accumulated number of vaccinations to cover 13.82 million doses today. Now, moving over to the general statistics, and the new confirmed cases we have reported today stands at 9,692 cases. We have active cases now standing at 106,951 cases. We have a good number of new recoveries today, standing at 5,730 cases, which means also 5,730 free more beds. And regretfully, we have new fatalities today standing at 67. And Bangkok again has the highest fatalities at 47 cases. Therefore, the total number of fatalities we have in Thailand standing today at 3,005. And our thoughts and prayers are with the friends and families of the deceased. Now, allow me to move forward to explain what has been discussed during the special CCSA meeting today. The meeting has now recategorized and added new provinces to the dark red zone. an additional 7 provinces. And these are Chonburi, Chacheongseao, Rayong, Ratchaburi, Udon Thani, Surin, and Ubon Ratchathani. And these 7 provinces have detected over 100 new confirmed infections, and therefore it is advised that people residing in these 7 provinces practice the same public health measures as announced in the maximum controlled area, that's in Bangkok plus 9 provinces. The CCSA meeting also discussed how they need to stress and strengthen measures, these 2 important approaches to help improve the local transmissions in Thailand. Most importantly, first of all, is testing and disease surveillance. Secondly, is to increase medical and bed capacity. And in order to increase testing, the meeting has agreed that antigen test kits will be made available to the public for purchase. However, since these are specific medical devices and equipment, therefore they will be only available at pharmacies and hospitals, as pharmacists, professional pharmacists can give vital information to the public how these test kits can be used. And positive results from these antigen test kits will still require confirmation from RT-PCR tests by medical testing centers that have been approved by the Ministry of Public Health, as these home kits still can produce false positives or false negatives. Now, let me move along to talk about another important issue. The meeting also assessed the management of how they have been implementing community isolation centers within Bangkok. And it has been found that currently the 27 community isolation centers in Bangkok, which house about 2,950 beds, have been managed quite smoothly. And this is due to the joint cooperation of the Bangkok Metropolitan Administration and public health authorities, as well as civil society and and local communities who have given their consent and have helped and assisted the authorities in taking care of COVID patients, as well as making sure that the environment around those community isolation centers are safe for the rest of the community. So we appreciate this collective and collaborative scheme. So thank you to the public for that. And also, the meeting talked also about going along with home community isolation quarantine schemes. And for each home isolation case, this has to be approved by authorities because they need to meet the requirements. For instance, home isolation will be for those who may have the virus but either asymptomatic or display mild symptoms, or those who are waiting for hospital beds, or those who have been allowed to recover at home by doctors or physicians. But the most important rule for home isolation is that the patient must be living with only one other person. If the patient lives with a large family in a single house, home isolation will not be permissible. Now, allow me to address some fake news that have been circulating around social media saying that Ministry of Foreign Affairs has been providing free vaccinations for foreign nationals, and those who want to get the jabs must register your personal information via an online form. So I need to point out that this report is false. Do not follow that advice, as right now pre-registration for vaccination for foreign nationals is only available through thailandintervac.com if this is through online channels. Once registration is complete, you must wait for an appointment confirmation from the hospital to specify the date and time you can come in to receive your shots. And also concerns have been circulating in media regarding the proposal by our medical experts. And this has also been talked and discussed at the CCSA meeting today about why or how Thailand will be administering combined vaccines manufactured through different technologies to the general public. And specifically in Thailand's case is Sinovac vaccines as the first shot and AstraZeneca as the second shot. And this has been confirmed through research by our medical and virology experts at medical colleges to be safe and efficient. And therefore, AstraZeneca shots can be administered after Sinovac vaccines, after the first shot of Sinovac vaccines over a period of 3 to 4 weeks. So first of all, take the first shot of Sinovac vaccine. After 3 or 4 weeks, then you take AstraZeneca. And also regarding the booster shots for medical frontline workers who've received both shots of Sinovac vaccines, a booster shot with either AstraZeneca or another vaccine through mRNA technology will be administered at least 4 weeks after the second shot of Sinovac vaccine, and this has been approved by the meeting today. And all of this is based on expert studies and evidence. So before I leave today, I'd like to address once again the importance of following our public health measures very strictly, as inconvenient as they may be. But this is vital to save lives and to reduce the risk of more local transmissions, which will exacerbate the situation in Thailand. And also, I'd like to address the importance of being more vigilant about misinformation and false news that have recently been widespread in both mainstream and social media. And this is detrimental to public safety as well as much as the disease itself, at a time when people depend on the need to keep up with vital updates on public health measures to understand how they could live safely with COVID. I would like to urge the public, including all foreign nationals, to seek out information from official websites and sources such as thailandintervac.com, as well as announcements from the CCSA, from the Public Health Ministry, their press conferences every day, every afternoon from the Ministry of Foreign Affairs and the World Health Organization's websites and social pages. Do keep in mind that fake and unreliable information can cause more harm than good. And this is what you must bear in mind before you share such information. You may also ask and make requests to our social media accounts as well, and we will reply them if we can during our press briefings as well. So that wraps up my briefing today. I thank you very much for your kind attention. We'll be back again on Monday for another press briefing. ขอบคุณค่ะ สวัสดีค่ะ
ขอบคุณนะครับ